Welcome to Medical Student Life in Japan, a podcast created by a teacher and a group of students at Nara Medical University. We are a small medical college in the Kansai region of Japan. This podcast has two great purposes. One is to share stories about being a medical student here in Japan, and also for our students to share fun ideas, opinions, and information about Japanese culture to people all over the world. Thanks a lot for listening. Welcome back to Medical Student Life in Japan. We're glad to have you with us as always. It's been fun as usual to check all of the data and notice we are now at listeners from 40 different countries around the world. So thanks as always for listening. The students are excited about that, and we would always appreciate any feedback. We do know through Apple Podcasts, Anchor, and probably Spotify as well, you can leave us a voice message, which the students have found really encouraging. Please also like or share the podcast. The more listeners we have, the more motivating it is for us to keep on going, for the students especially, doing their best to improve their English and share great information about medical college and life in Japan. Today we have a special two-part podcast. The first part of the podcast is a bit light, a light, fun discussion with two great students talking about the upcoming exams. I don't know if that part's fun, but also talking about their plans for summer vacation. The second part is, I think, one of our best discussions so far, so I think you'll really enjoy it. But I do have to say, for any of you who are a little queasy when it comes to talking about anatomy, it's a discussion about anatomy class, and the students are now working with cadavers, so it gets pretty detailed. It's very interesting, but I just wanted to warn you, the students go into a great detail. Okay, so let's go ahead and get started with the podcast. Here we go. Okay, welcome back to Medical Student Life in Japan. And we're going to start this week's podcast with Yuka and Misaki, who we're joining together here on Zoom and recording today's podcast. And so we thought it's the end of June, nearly July, and these two students are getting ready for summer vacation. But before that, maybe you have some exams coming up. Yuka, do you have final exams coming up now?
Yeah, I feel nervous.
You feel nervous. How many exams do you have next month? About
eight. About eight.
8 exams. Wow, that's a lot.
Yeah.
And all exams are in July?
Yes, in July.
In July. Okay. How about Misaki? How many exams do you have?
We have 3 in July, and the other ones are in September, in the first week of September.
I see. Okay, so maybe it's better in second year?
But
No?
we have to study during summer vacation.
That's true. Good point. Okay, Misaki, you make up. That's a really good point. So, yeah, you'd probably be happy to be finished in July, so you can just. I see. Okay, so Yuka, you can actually relax after you're done studying.
Yeah.
Yuka, which test are you most worried about? Which do you think is the most difficult, and why?
I worried. I don't know what say in Japanese, in English.
Okay.
But the content is nursing for mothers and children.
Oh, okay. Okay, maybe maternity studies?
Yeah, maternity.
Okay, yeah. I guess there's a lot of information you need to know.
Yeah.
Okay. And when is that? When is your test for maternity studies?
We haven't, we can't know now.
Oh, okay. You're
That's
still.
because the university don't tell the schedule.
I see.
But last last week in July,
Okay. Okay. So you have about 1 month to study for
yeah,
that test. Okay. How about Misaki? What test are you concerned about or worried about any of your exams?
In July 7th, we have a histology test.
Okay, July
Yeah.
7th.
Yeah, and I've heard that it's very tough. So next week, I
Yeah.
think.
Next Wednesday. Okay.
Yeah.
Yeah.
So I have to study for that. Yeah, I'm now studying hard for that test.
What makes it so difficult, do you think?
Uh, we have to draw many pictures and explain about the pictures, so we have to remember what the picture says and also what it is about.
I kind of remember that because I taught a few students a few years ago and they were preparing for that exam, I think.
Uh,
Maybe is it difficult if you're not good at drawing? It must be difficult, right?
yeah, but I think that the teacher doesn't mind whether the drawing is good or bad, but we have to the explanation. I think is most
Oh, okay.
important.
I see. Yeah, I just remember some students, one student specifically, her drawings were amazing.
Mm.
She was so good at drawing. And another student and her and I were having lunch together, and the other student wasn't good at drawing, and he was saying, "Oh, it's so hard for me because I'm not good at
Uh,
drawing, and she's so good." So I think it's easier to explain maybe the picture if you're good at illustrating.
yeah.
How about you, Misaki? Are you good at drawing pictures?
No, I'm not good at drawing, and today my friend looked at my drawings and said that that's not good, and he was laughing. So,
Okay. Well, maybe you need to practice before the test.
yeah.
Okay. Well, okay. So you got tests coming up, but Yuko, you'll be done at the end of July, and then you have a summer vacation for about a month and a half, I guess. Yeah. Yuka, do you have any plans for summer vacation?
in summer vacation, nursing students have class in hospital,
Okay.
so we can't go out everywhere.
Oh no.
Yeah.
Wow. So you have class all of August?
Last week in August and
Last week in August.
first week in September.
Oh, okay. So 2 weeks you'll have,
Yeah.
and you'll be visiting the hospital.
Yeah, and have patients and check their condition.
Oh, okay. Well, that'll be interesting.
But too difficult for us.
Yeah. Okay, so maybe this summer you don't plan to do anything like a traveling.
Yeah.
But maybe you do something, right? Do you have something you want to do in the summer besides study?
I want to watch Titanic movie.
Titanic, the movie.
Yeah.
Oh, by James Cameron.
Yeah.
Yeah, he's a great
I
director.
bought Blu-ray.
Oh, you've never seen the movie before?
Last month we have broadcast on TV
Oh, okay.
and I watched in Japanese.
Oh, okay. So you want to watch it in English this time?
Yeah.
Oh, that's great. Yeah, that's a really good movie.
I can't wait.
Yeah, I remember I saw that in the movie theater when it came out. Maybe 1997, maybe around that time. So I was around your age at the time when it came out, but it was really, really, really popular. It was a really big movie, and James Cameron's a really great director. How about you, Misaki? Maybe you get a break. I know you have to study for your September test, but do you have any plans?
My parents are planning. I don't know whether we can go because of the pandemic, but my parents are planning to go hiking for Mount Fuji. We are going to climb Mount Fuji.
Oh, wow. I think last year it was like completely closed, right?
Oh, yeah, but this year I think we can climb if there's no.
Does your family often go hiking?
No, this is the first time, so I wonder whether we can make it to the top.
Your very first hike together, and you're doing Mount Fuji.
Yeah.
Oh, I've never done Mount Fuji, but I have some friends who have, and
Oh,
I think it's pretty hard.
oh, really?
It depends. I think you can start at different levels. So
Oh,
depending on where you drive to or take the bus to, you can start a little bit higher up. Maybe that's
oh,
easier, but I think it's a little bit challenging though.
oh,
I mean, I'm sure your family is very healthy, so probably no problem, but maybe you should do some practice hiking before you go.
yeah. I have to do training.
Do a little bit of training. I think that's a
Yeah.
good idea. Wow, that'll be great. Yeah. And that's in Shizuoka Prefecture, I think.
Yeah, Shizuoka and Yamanashi.
Okay. So you'll go there and do hiking. Maybe will you stay a few days?
Yeah. My father said that we will stay for about 4 days.
Okay.
Yeah.
Are you going to be like a camping or maybe stay at a hotel? Or?
I think we're going to stay at a cottage.
Oh, cottage.
In the mountain.
Wow, that sounds nice. Well, I hope you're able to go. As you mentioned, it's so hard to tell even now.
Yeah.
When people ask, "What are you going to do this summer?" You say, "Oh, I want to do this if it's possible." We don't know because of the pandemic, and it's a tough situation. Okay, well, we're going to finish up here, and I hope all of your exams go well. I know you're both good students, so I'm not worried about you. You'll be fine, and hopefully Misaki can go on her trip to Mount Fuji, and hopefully Yuka has some time to relax, even though you have to visit the hospital. But that'll be interesting too. But hopefully you have some free time to watch some movies like a Titanic or something else. So, okay, thank you very much.
Hi, the second year medical students in Nara Medical University have great opportunity, and it's anatomy class. We can directly dissect cadavers and see organs. I'm now a third year medical student. I've finished all of the anatomy classes, and today there are two second year medical students who have just finished their dissecting cadavers, and there is one first year medical student, Koshiro. I think he has some concerns or expectations and many questions for anatomy classes. So let's talk about this topic, anatomy class.
Okay. First, I have a question that I heard the news that some organizations argue that NMU should not use animals for anatomy. But what kind of class do you have instead of that?
Usually in the past, first year medical students do dissecting animals, and then second year medical students do dissecting human bodies. When I was a first year medical student, I was able to dissect many kinds of animals like frogs, fish, mice, and so on, but now we cannot do, first year medical students cannot do, because there are some people who wanted to improve the animal welfare.
So, instead of using animals, do you do other things for the class to understand the animal's structure?
I think instead of using real animals, you can use computer and look at some simulators on the screen.
Do you do that class now?
In the pharmacology class, I used internet to measure some medication in the animal by using simulator.
Is it better than using real animal?
Usually, even if we use real animals, only 2 mice can be used in the class. But if we use simulator, every student can measure and see the changes of medication in the animal. So students can participate in the class more actively if we use simulator.
So it's not only bad points.
Yeah.
Okay. Then next, I want to ask the first second year students.
Okay.
And how many members do you have in each group?
About 4 or 5 members each group, and one group have one one body.
Do you first have difficulty doing some anatomy class?
Yes. So, and the schedule is very busy, and we need to prepare many things. So we need to do preparation before the anatomy class, and very busy.
How about you?
Me? Yeah, I agree with him that the schedule was really tight, and we have to remember the name of organs and the location where it is and the function of it, and we have to remember the procedure of the anatomy. So it was hard for me, and also it was after the class we get really exhausted. So, and at that situation we have to prepare for the class. So yeah, it was, I can't really explain, but it was really just exhausted.
Yeah. We have to stand for at least 3 hours in successive.
So
It's very hard for students, and some argue that it will be bad for their waist.
So it's hard for both physical and mental.
Yeah. And how about the smell of the cadavers?
I didn't feel so bad from the first class, but I heard that some others say they don't think it is good. How about you?
Yes, I think the smell is very bad because smell is the hormone, so the smell is very strong, and the distance is very near, so the more strong than it's more strong.
Yeah, through the anatomy class, we students use each group uses only one body from the beginning to the end. So cadavers needed to be saved in the medication named hormone. To me, it was bad. The smell was bad, and it reduced my appetite for lunch. Plus, at first, students have to peel every skin of the cadaver and then move fat. So if the group has a female cadaver, it was much hard for move because female have more fat than male cadaver. And I'm interested in, do you have any favorite organ?
Maybe we both like the brain, because for me it was just the brain I expected before the class, and yeah, it was very complicated, and I just thought, wow, and it was amazing. How about you?
Yes, when I do the anatomy class, I saw the first range lung. The lung is become the different side, right and left, because the blood is much more bigger than before, and they broke the air throughway, so the left lung is very small than right lung. So I'm very interested in it.
I see. Do you have any questions?
I'm a little nervous now because I heard some negative point of anatomy class. So, do you have some good points of anatomy class?
Do you find anything interesting in the class?
Yeah, and it was, I don't know the other country, but in Japan, the doctor and the medical student can only do anatomy for human body. And it was maybe really good experience for us, and we can know the location and function from the textbook for each organs, but yeah, it is more than it is more great for us, for me, to do anatomy by myself, and so we can see the inside of the body, and it was very interesting for me. How about you?
Yes, I think so too. So only doctor or medical students can cut off the body. So it's very rare case to do that, and we can see the real organs and some skin, so we cannot see in the daily life. So it's very interesting.
Other than,
So it's very good experience to have deep understanding.
Yes.
but you have to prepare well before the dissection.
So I have to study anyway.
Yes.
Of course. You have to.
You have to pass the anatomy examination after the dissection. So through the experiment, you have to memorize efficiently.
So maybe much harder than first year.
Second year maybe is the hardest year.
Yes, there are a lot of technical terms, so we need to do much more. Remember.
Memorize the term.
I will study hard.
And are there any changes in the cadavers?
So for me, I could. So at the body I diverse. So I cut it. Was he was dead by his age, so so it was very normal body.
Mm-hmm.
So when I saw the other body, that body I saw has a cancer, and I saw the difference between the normal one and that one has cancer, and I touched and I see the color, and it was a lot difference between that, and it was very interesting, and it was good experience for me.
Yeah.
Do you have any? How about you?
Yes. I saw the hernia. Hernia is like the some substance go out from the bone, and it makes some pains to the patient, and it's very hard to, and when we touched it, it's very hard, and it's hernia. Everyone surprised that.
Yeah, each dead body has something wrong with your organ, and I saw one had a shrunk brain because of his brain disease, and another cadaver lacks ovary. So it's very interesting to look something different between cadavers.
Yes.
Do you have any interesting thing?
In anatomy class.
Oh yeah.
So do you have?
I think at the end of the anatomy class, we have to get every organ back again and clean the body. Did you do anything else at the end of the class?
We gave flowers for each the body, and we just prayed for the last time, and we just felt we just respect and we just thank for that they gave their dead body so we can study, and I thought very thankful him and her. Yeah. Yes. Maybe he agree with me.
Yeah, all of the cadavers are volunteers selected from elderly people, so we have to be grateful to them and pray. Do you have any questions?
I have no question now.
Okay, then thank you for answering many questions.